Welcome back to the forum. I'm Daniel Pizarro from the Parliamentary Press Gallery. Tanja Hirvonen is a clinical psychologist, usually based in Durham, but she's currently in Mount Isa in Queensland. She's a member of the Australian Indigenous Psychologists Association, has worked with the Aboriginal Medical Services Association Northern Territory and the Centre for Remote Health, and she joins me now. Tanja, thank you very much. What can you tell us about your role? What is a clinical psychologist first?
So thank you, Daniel. A clinical psychologist is a person that finishes their psychology degree, but then goes on to learn further training to become a specialist in the area of mental health and psychological assessment. So it is a deeper understanding in training. And what do I currently do in the role? So Monday to Friday, I work in policy and research, but I also am able to provide telehealth appointments to people in the Northern Territory at this time, which is either can be Zoom or Skype and telephone. And I also provide psychological assessment at times when I have the opportunity or the time to do that. And why did I decide to become a clinical psychologist? I noticed the disparity of people in remote and rural areas not being able to have access to people that are knowledgeable around social emotional wellbeing and mental health, and also I was really interested in how people were able to get through really, really tricky, challenging and traumatic circumstances as young people. I mean, I was really interested in that, and was there a way that I could actually be of support to that for helping people get through whatever they may be getting through. And also there were very low numbers of people, low numbers of Aboriginal and Torres Strait Islander psychologists. There's still quite a small number, and I wanted to be part of that cohort, to be working in this space, to be able to provide another, the Aboriginal lens to social emotional wellbeing and mental health for Aboriginal and Torres Strait Islander people. So thank you, Daniel.
Why did you decide to become a clinical psychologist?
Well, I wanted to be a psychologist, and when I was going along that journey, there was an opportunity to actually study further and become a clinical psychologist. And I was actually encouraged by lecturers from University of Southern Queensland to follow through. So, but going back to your question about why did I choose to become a psychologist, I actually saw the disparity of services or the lack of services in remote areas in Australia. And, it's a way of wanting to be able to give something back or be able to provide something back to people living in remote rural areas. The other part to why I wanted to become a psychologist was understanding why some people can experience tragedy or trauma in their lives and have the skills and the abilities to get through, to understand how people were able to manage or still progress through life in spite of challenges. So I was really interested around human behaviour as part of that.
What challenges do you see young Indigenous women facing?
Well, there are challenges, and we've seen with 2020 there have been the challenges for this pandemic. Being able to, I guess it's same as the rest of the population, being able to see family, visit family, complete university degrees, placements may have been put on hold. So, there's challenges in different areas of life. The work challenges, the personal challenges like being in isolation. But more broadly, actually there are challenges, but there's also opportunities, Daniel. So there are opportunities to, if the opportunities are available, to be able to, take these opportunities with education and training, and hopefully these opportunities become more available as time goes on, and they are becoming more available. So again, there are challenges, but there's also opportunities on the back of that to be able to be doing something or living the life that you're wanting to live. There's many challenges for young Indigenous women. We've had the education challenges or personal challenges, and there's also challenges around systems, in health and education, legal. So yeah, there are challenges, but there's also opportunities.
How would you encourage them to pursue a career in science?
How would you encourage a young person to pursue a career in science? So again, there's 60 to 80,000 years of knowledge and understandings in science with Aboriginal and Torres Strait Islander culture. Yet there's also that mainstream understanding, and having the knowledge for both the Aboriginal and Torres Strait Islander understanding and then the mainstream understanding. You're actually able to merge or complement or supplement the two understandings. So I certainly encourage people to pursue careers in science, because and also it just brings the extra lens. Like if you're an Aboriginal and Torres Strait Islander person working in science or a science career, it brings diversity to those professions and more understandings from different lenses.
What is culturally sound? What does that mean? What are the ways that you explain that to it? What is culturally sound ways to make a difference to the health and well-being of people? What does culturally sound mean?
I would term that as culturally safe ways. So culturally safe ways to make a difference is working in a way that is culturally safe, which means that we're checking in with the client and their perspective, or the family or the community, and working in ways that doesn't allow another culture to impose another culture, or another understanding imposed on another understanding. Because if we are able to work with the person's, with what the person feels is culturally safe and sound, we're not perpetuating any further harm for that person or the family or the community. And there's so many examples of culturally unsafe ways or culturally unsound ways. Ways to actually become culturally safe is to first understand, you have the cultural, cultural competency type training about what we should be doing and what we shouldn't be doing, when we are working with Aboriginal and Torres Strait Islander people. But even further than that, it's much deeper than that. It's then continually reflecting on the work that we do, and not reflecting within your own profession or with each other, but actually engaging with community as part of that, understanding and hearing back from the people that we are maybe even working with, whether or not we are being helpful or we were not helpful, and having those conversations about what needs to be done and what we need to be doing to be providing a healthy service and not perpetuating any further harms on anyone that we're working with.
And what is chronic pain, and what ways are there to combat it? I know, of course, that this is an issue that is facing many Indigenous Australians.
So, so chronic pain, look, I'm not too sure of the numbers or statistics around chronic pain. We also have, disadvantages around the high suicide rates. We also have high rates of chronic illness, and then it goes on. But chronic pain is certainly a factor in health and well-being. So chronic pain is pain that has been continues after more than 6 months, and even after treatment, like there's still a level of pain that someone is experiencing or feeling. With chronic pain, there are many ways to combat it, but I liken it to our social and emotional well-being model. Like, you do need integrative care, you need interdisciplinary team to manage chronic pain. You also need to be ensuring that you are culturally safe in some of the strategies and the treatments for chronic pain. And again, it has to be individualized. What would work for one person in one area might be different for another person in another area. And then there's also those factors around having the relationships with the entire team, the physiotherapist, the occupational therapist, the psychologist all needs to be on board to be managing chronic pain. It is one of the most complex, complex conditions that you can actually be working with, and it does need that interdisciplinary care. It has made it trickier with coronavirus and not being able to see people face to face, provide care. However, just from recent experiences, you're still able to provide a level of care through telehealth or Skype or Zoom to still be providing psychological care when someone is experiencing chronic pain.
Tanja Hirvonen, thank you very much for your time.